Are we ready to begin?
Yes, I believe so.
Thank you very much. Then I will introduce myself, County Supervisor Joe Simidian, serving as chair of our Federal Affairs Advocacy Task Force. And the first item of business is this call to order. And in order to effectuate the call to order, we ask the clerk to call the roll, which is all of 2 people, given the size of our task force. Go right away. Go right ahead.
Vice Chairperson Lee.
Good morning, present.
Thank you. And Chairperson Simidian.
Here. Thank you very much. We have established the presence of a quorum. The call to order is complete. That takes us to item number 2, which is public comment. Public comment, of course, is that portion of our agenda set aside for comment by members of the public on non-agendized items. Again, folks, things that are not on our agenda, but that are otherwise properly within the jurisdiction of this committee. Do we have folks who are signed up under public comment? I'm turning to the clerk to ask.
There are no hands raised at this time.
Thank you. Then that takes us to item number 3, which is to approve the consent calendar and any changes to the task force agenda. Supervisor Lee, unless you have changes you want to suggest, a simple motion to approve the consent calendar, which is simply our Brown Act item, would be appreciated.
It's a motion to approve the consent calendar.
Thank you. Motion by Supervisor Lee, second by myself. And let me just confirm with the clerk, there are no speakers on this item.
Correct.
So we'll call the roll, please.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye. Thank you very much. That takes us to item number 4, which is to receive verbal reports, oral reports from either the chair or the vice chair. I have nothing to provide here. Before we get to the heart of our meeting, I will have a question for the county executive in a moment when we ask him if he's got an oral report, but nothing for me. Let me turn to Supervisor Lee and just say we're having a little trouble, at least I am, Supervisor, with the volume at your end. So anything you can do to speak right up would be helpful. Thank you. Anything from you on this item?
No, the only thing I do want to mention, of course, is the issue related to the current tension with what we see over in the Eastern Europe, what's going on in Ukraine and Russia, somewhat related to the federal affairs issue. Obviously, this is a national.
Supervisor, I apologize for the interruption, but Madam Clerk, is it just my end where we're having trouble, or is it faint at your end as well?
It does seem that Vice Chairperson Lee, your audio is a tad low on my end as well.
Oh, okay. All right.
There you go.
There you
That was
go.
better, whatever just
Closer.
happened.
Okay.
Thank you very much.
Is this any
Supervisor.
better?
It's much better, at least at my end. Thank you.
Okay, good. Thank you. So, yeah, I just want to mention that due to the latest news that everybody is seeing with what's going on in Eastern Europe relating to Ukraine, and I just want to see if there's any discussion that we should have relating to this issue being the Federal Affairs Task Force today.
Supervisor, I had some of the same thoughts, and I'm going to try and start that conversation on item number 5 when we get the report from the county executive.
Okay, very good. We'll just save it for that time then. Thank you.
All right. Thank you. Let me check with the clerk, make sure there's nobody who had signed up to speak under item number 4.
That's correct. No hands.
All right. That takes us to item number 5. Dr. Smith, anything you'd like to share before we move into the other items? It sounds like Supervisor Lee and I both have a couple of questions or comments to toss your way, but let's start with you, sir.
Well, I was going to talk a little bit about Ukraine, but since you're going to bring it up, I'll move on to another issue, which has to do with our budget. The process that the feds are currently going through to approve their budget and their, should I say, delays are going to have an effect upon our cash flow, mostly because of the payments that are coming from the state that are funded by the federal government, having to do with our health system supplemental payments, which have already slowed down considerably and are contained in the majority of our accounts receivable to the tune of about $300 million. So that's going to be a big problem unless we get some action going at the state and the federal level to get that money freed up it's causing problems for other counties too. So with that, I suppose I'll just take questions about the Ukraine.
All right, thank you. And I do note that as we often do, we have the benefit of having Tom Pike, the district director from Supervisor Rokana, from Congressman Rokana's office on the call with us. When we get to item number 7, where we talk to various federal executive and legislative actions, I'll ask Mr. Pike if he'd like to lean in and has anything to share there. I know I'm coming at him here kind of out of the blue, but we'll just see if he's got thoughts when we get to item 7. Staying on item 5, where we are at present, and before I turn to Supervisor Lee, and it sounds like we have some overlapping concerns. Dr. Smith, I'm curious to ask, do we have any financial investments which, if directed by our board, you all might be able to review to see whether we are in any way invested in interests that are connected to the situation in Ukraine and Russia investments in particular? Forgive me for being a little bit vague there, but I'm not sure what the possibilities might be, and that's why I wanted to ask you. And obviously too late to agendize something for our meeting coming up next week, but it's something we might ask you to take a look at and report back to us on at that time. Why don't I stop there? And before I let you answer, let me go to Supervisor Lee and see if he wants to chime in, add his own thoughts before you answer, just so you know what the nature of our interest is. Supervisor Lee?
Yes, certainly. Different levels of issues relating to Ukraine, certainly. We have a relationship with the Moscow County as a sister county as well, and that I'm thinking that whether we should, as a board, to propose to send a letter to send our concerns regarding what our fellow sister county commissioners are going through, and also our concerns about the Ukrainian situation and those who are suffering from there, number one. Second is regarding the refugee situation, because obviously with the close to 1 million refugees are now moving, how that would affect our county moving forward, like we have faced with the Afghanistan situation. So, and what type of work we need to do to prepare to make sure that we offer those assistance. So those are a couple of areas that came to mind that we should probably get ready for.
Thoughts for the moment, Dr. Smith? And again, possibility to have you simply come back to us and speak more fully on this if you'd like at when it's time for a report at next week's board meeting.
We've looked with a first look at our investments and don't have any clearly Russia-related investments. However, we're doing a deeper dive to make sure that none of the companies that we do have investments with do significant investment themselves with Russia. I doubt that we'll find much, but we're going to do that exercise anyhow. With regard to the sister city process, we canceled the sister city meeting. I think it was yesterday. That's when we canceled it. We're not going to be having any more meetings. We certainly could consider, with direction from the board, sending a letter expressing our concern. I think we've received lots of input from the public and from our employees. We have a fairly large contingent of Ukrainian American employees who are very worried about this whole situation, obviously, as we all are. I think there's a valid question to be asked whether we should terminate our sister city relationship or not. We won't be doing that administratively. We'll ask the board whether they think that's a good idea or not. In terms of refugees, we're always prepared for refugees. We were prepared for Afghan refugees and the refugees from the border. And we will continue to be prepared for any Ukrainian refugees. I'm not aware at this point of any need in our region, but we will keep our eyes on that through the Office of Immigrant Relations. Less significant, but still I think important, we've changed the coloration of the ribbon on the outside of the building to show solidarity for the Ukraine by having it blue and yellow, which are the colors of the Ukrainian flag. We will keep close tabs on the entire process, as will, I'm sure, everyone. War is definitely a huge risk for all of us. It's definitely a risk for the county budget and the services that we need to provide for our clients. And we're very concerned about it. The possibility of escalation, as you well know, and as everyone knows, is quite high. So that's probably all I can say about that at this point.
All right. Thank you very much, Dr. Smith. Dr. Smith, can we ask you to sort of speak a little more fully to these, I'll call them Ukraine/Russia related issues at our board meeting on Tuesday, when you've had a little time to pull together some more information and have a understanding of at least what a couple of board members have an interest in?
Surely.
All right. Thank you for that. Let me see if Supervisor Lee has other comments or questions under 5, CEO verbal report, before I ask the clerk whether or not we have any members of the public queued up to speak on that item.
No, that's all I have. Thank you very much, Chair.
All right, thank you. And let me ask the clerk, anyone queued up to speak on item number 5?
There are no public comments at this time.
All right, then let's go on to item number 6. And excuse me, Madam Clerk, I'll just indicate items number 4 and item number 5 were simply to receive the oral reports. I will simply ask if there's any objection to receiving those reports, and then say hearing none, without objection, they are deemed received. Okay?
Okay, thank you.
Thank you. Takes us to item number 6, and that is the report from the Office of the County Council. And let me ask who's going to be delivering that report today?
Hi, good morning, Chairperson Simidian and Vice Chairperson Lee. This is Douglas Press, Assistant County Counsel from the Office of the County Council. A little shorter presentation today, but I just wanted to focus on something that frankly is both relevant and recent, and that is just some of the more recent activities regarding the public charge rule litigation. And this is on page 3 of the chart for those of us who are following along the County Council chart that we attach to these meeting agendas. So recall that the board demonstrated once again its leadership in the protection of immigrant rights and public benefit rights by authorizing the first in the nation lawsuit challenging the Trump administration's public charge rule from 2019. And just to bring everyone up to date, since I don't know how closely everyone has followed this, but you may recall that we secured a preliminary injunction. It was geographically limited, but it was a preliminary injunction nonetheless. That was, of course, then appealed by the federal government to the Ninth Circuit. We got a 2-to-1 affirmance from the Ninth Circuit. And then in addition, there were many, many other challenges around the nation. In particular, out of the Northern District of Illinois, in the federal court there, a nationwide injunction ultimately issued. Anyway, as you can imagine, a lot of these cases were making their way up through the appellate system. And even for our case in particular, the Supreme Court, either we had a petition pending for them, or I think they might have even accepted the cert petition. In any event, this was getting queued up for the Supreme Court. And then, of course, we had the change in the federal administration. And the Biden administration, through a stipulation with the parties in our case, got the Supreme Court cert petition dismissed. And by the way, any attorneys on the line, you might be eligible for MCLE civil procedure credit after this section, because we have a lot of civil procedure to get through. So the bottom line was then is what happens now to this case where the Biden administration has decided that two things. One, it is no longer interested in defending the public charge rule, and therefore is acquiescing, as they say, and stipulating in many cases to dismissal of the lawsuits challenging the public charge rule. And simultaneously, the Biden administration issued what's called an advance notice of proposed rulemaking to promulgate a new rule to replace the public charge rule. Well, that all didn't sit well with a number of so-called red states. And again, parenthetically, I'll talk about this a little bit later, we have seen over the last year that the role that we played in challenging a number of rules and executive orders of the Trump administration, now a number of so-called red states are jumping into the fray to return the favor, if you will, challenging many things that the Biden administration is doing. So Arizona, led by 11 other, again, I call them so-called red states because it's obviously much more complicated than that. They moved to intervene in our lawsuit, excuse me, in the Ninth Circuit, saying, look here, if the federal government isn't interested in defending the public charge rule, we should be able to intervene and take their place and fight for this public charge rule in their stead. And the problem, though, is that Arizona and the 11 other states that were seeking to intervene literally were not covered by the geographic reach of the order that issued in our case. So it raises all sorts of fascinating issues. So they moved to intervene in the Ninth Circuit. Ninth Circuit denied it. They then had this brought to the Supreme Court, and the Supreme Court did hear this issue on whether these 12 states could intervene in our case. And that argument was heard last Wednesday, February 23rd. Based upon my review of the oral argument, it's very, very interesting. If you have a free 90 minutes, it's worth a good listen. It's obviously no one wants to get in the business of predicting how the Supreme Court will rule, but it did sound to me as if a number of justices were suspect about letting these states intervene, particularly in our lawsuit, where it was only about a preliminary injunction and it didn't actually cover or affect the petitioning states. There are other actions around the nation where they might have a greater claim to intervention. But the issue was, and we've discussed this many times, is how to unwind a federal rule that a subsequent administration is no longer interested in maintaining or in defending. And so the question here, which was really interesting for a number of the justices, was when you have a federal court saying this particular federal rule is unlawful for however many different reasons, and vacates the rule, as it happened in the overall scheme of things with this rule, does the federal government then need to do public notice and comment to essentially no longer pursue or allow to be pursued any sort of action on a fully enjoined and vacated rule? Because remember, in the normal course, if you want to undo a rule that was promulgated with notice and comment rulemaking process, to undo it, you have to go through notice and comment to repeal or amend the rule. And so that is why it takes many years to unwind a rule done by the previous administration. We saw this with the Trump administration. It took years for the Trump administration to unwind some of the Obama administration's rules. And similarly, as it is with some of the Title IX rules and some of the other rules that this county is following very closely, it is taking a substantial amount of time to go through the notice and comment unwinding of those other rules that we don't like and that the Biden administration doesn't like either. So that's kind of the issue that the court is wrestling with, is what sort of process should follow in terms of what to do about a rule that has been vacated by a federal court, where the incoming federal administration is no longer interested in pursuing the legal challenge. So who knows how long it will take? Certainly we'll get a decision in the next few months, but that was the issue in that case. And we submitted briefing in that case, and we also, in terms of the advanced proposed rulemaking for the effort to replace the public charge rule, we've also submitted some comments, and will continue to participate in those efforts as well. So that's sort of the main event, but similar in theme, since so many of the matters that we are following in our county council chart really fall into two categories. They're federal rules or they're federal executive actions. That on the federal rule side, since so many of those require some significant degree of unwinding, and the Biden administration has indicated in just about every single one of those lawsuits that it is very seriously reconsidering, if not in fact reconsidering those rules. A lot of those matters are held in some form of abeyance. I will note, though, that both when you look at the whole chart, whether it's rules and or executive actions, there are 10 other matters where there is this so-called red state either intervention or even initiation of lawsuit against the federal government. So certainly there's going to be a lot of different items that this board may want to continue to consider to weigh in on, because this is obviously, this issue writ large is not going away. Any questions? Supervisor Smitty, and I believe you're muted.
My apologies. 2 years in, you'd think that would be a routine reflex, but it's still not. Mr. President, anything else you'd like to report in on before we go to questions? Because I think probably easiest if we just take questions from Supervisor Lee and myself after the fullness of your report. So
that's all I have to report today.
All right. So the rulemaking issue, Supervisor Lee, and the public charge issue is the one that Mr. Press is focused on today. Any comments, questions, Supervisor Lee?
Thank you, Mr. Press, for the MCLE credit that I will be getting for this class today. So the bluff or the bottom line up front is that this is still ongoing because of the hearing in the court. So we are still waiting basically at this point for the Supreme Court to rule on it, right?
Yes, we're still waiting for the Supreme Court to rule on our particular case and whether these 12 states can intervene in our case. But what many of the justices signaled in their questioning and comments were, isn't the real action coming out of the Seventh Circuit, where that's the appeal of the Northern District of Illinois permanent injunction and vacatur of the rule in that action. In other words, they kept sort of suggesting either A, don't you want to intervene in that action? The answer is many of these states have, but there hasn't been a ruling on that, I believe, from the Seventh Circuit. And then some of the other commentary is from the Supreme Court justices was, if your argument, 12 states, is that there should have been notice and comment to formally repeal the public charge rule, notwithstanding the orders and injunctions against it, why isn't that just an Administrative Procedure Act lawsuit that you could have initiated? And why didn't you initiate that? And if so, they would have had to initiate that in the District of Columbia District Court. So again, the civil procedural tentacles here literally run nationwide. So there's just a lot of things to sort out, but it did seem to me that for the types of issues that these 12 states wanted to raise, that our case might not have been the best vehicle. So we'll have to see.
All right, thank you for
And then
that.
the,
Supervisor Lee, other
Oh, yeah,
comments? or
one more
questions?
question, if I may.
Please.
Sure.
Yeah, sorry. On the issue of family separation on page 22 and 23,
Uh-huh.
the notes stated that on January 28th, the court basically, in this case, granted the motion, all that. So just the bottom line up front, is this basically saying that the order from the court on that family separation case is to allow these families to be likely to be reunited sooner than later?
Yeah, I'm just looking at the notes here myself. Party's motion. Yes, that sounds like that.
Okay, good.
Yep.
So I just wanted to keep those short and sweet. Okay, thank you.
Yep.
That's all
Thank
I have.
you. Mr. Press, briefly, please, can you just give us your best layman's description of what a rule is?
Certainly.
And I have, we have two lawyers here on the task force, but I find I have struggled, as I have shared with constituents who say, well, they think they know what a law or statute is, and they think they know what a executive order is. But when I start talking about the rulemaking process, they say, well, wait a minute, what's that about? And I'm just wondering if there is in your world a sort of a shorthand descriptor for what a rule is, where it comes from, and what authority it does or doesn't have.
Absolutely. And by the way, I'll just say parenthetically that administrative law is, I think, one of the most interesting topics because it touches every aspect of our lives, whether we realize it or not. But in brief, so we all know
Mr. Press, nobody's going to invite you and me to a holiday party to talk about rulemaking, I'm pretty sure. So, but go right ahead.
Sure. So we all know about how laws are made, et cetera. So let's just use an example. Congress comes up with a law and they set sort of broad parameters of here's what we want to have accomplished with this broad law. But now all the little intricacies of exactly how that law is to be implemented and affecting all these different types of people, businesses, circumstances, that enormous amount of detail Congress will typically leave to an administrative agency to fill in with those details. And so what the statute will do is basically two things. One is it will say, here's the legislative command of what we want you to accomplish with this statute. And then number two, we're going to delegate the authority to a particular administrative agency. And now we're essentially giving you our congressional authority to fill in the blanks through administrative rules. And so rulemaking then is when the administrative agency, with that permission from Congress, then says, okay, now we're going to promulgate rules, for example, rules to implement the Affordable Care Act. And part of what rulemaking requires is fundamentally two things. One is called notice, and the other is comment. And so notice is the federal government will publish, typically in the Federal Register, a proposed rule or even an advance notice of proposed rule saying, here's what we're thinking of doing. Here's the statute we're trying to implement. Here's what Congress told us to do as far as filling out the details. So here's what we're thinking of doing. And so we're going to invite all interested parties, any member of the public, to please weigh in and comment for us and help us essentially shape this forthcoming rulemaking. And then depending on what they receive from stakeholders and members of the public, they will then, consider that and maybe reshape the rule and then come out with something in their proposed rule. And then at that point, they might even hold hearings, at which time they might receive further commentary and then perhaps even revise the rule further. It's only after that whole notice and comment process occurs, then the federal administrative agency issues a final rule. And that rule then, also known as a regulation, that rule then has the force of law. And so there's all sorts of debate that's been going on, frankly, for decades about, wait a minute, how can we have these unelected bureaucrats come up with these rules? Why is, this isn't done by Congress? And the answer is, well, it was done by Congress because Congress gave this federal administrative agency and its officials the permission to fill in these gaps through these rules and regulations. So that is why if you took the Code of Federal, the federal law, the titles, all the different codes, that would probably fill maybe the length of one table. If you took all of the federal regulations implementing those federal laws, it would take up several tables because there's so much detail. Just thinking about all the different things to implement Social Security, the Affordable Care Act, food stamps, immigrant benefits, all sorts of things of that sort, that you can imagine, just enormous amount of detail. The detail is found in the rules. And that is why typically when someone is challenging a particular circumstance about themselves, the detail that they will need to figure out, are they eligible for something? Are they not eligible? That detail is found in the rules because, again, the statutes are written from a very high altitude.
All right, thank you for that. Let me just confirm with the clerk that we do not have speakers queued up for item number 6.
That is correct.
All right, then here again, we will say thank you, Mr. Press. This is simply a receive report item for our task force, and without objection and hearing none, we will consider the report received. Thank you very much. That takes us to item number 7, which is the report from the Office of the County Executive relating to the status of federal executive and legislative actions in response to COVID-19. And that, of course, includes, but is not limited to, at-home testing, federal relief funding, other similar issues. So, Ms. Christian, shall I start with you? Are you the air traffic controller to get us to the right place?
Yes, thank you, Chairperson Smitty, and I am that person serving in that role today.
And how shall we begin?
Well, we are going to begin with Prime Policy Group. As you may be aware, the federal government is currently operating under a continuing resolution, which funds the government through March 11th. Chairperson Rich Mead from Prime Policy Group will report on efforts to pass an omnibus measure to fund the federal government for the remainder of the current fiscal year, which goes through September. Following his report, Aaron Dorton, Senior Advisor from Prime Policy Group, will provide information on the shift in COVID response from pandemic to endemic, and a little additional information that is breaking news from this morning if she's able. So with that, I'd like to turn it over to Rich Mead.
Thank you so much. Welcome our friends from Prime.
Thank you so much. Great to be here. On February 9th, the four corners of the Appropriations Committee, the chairman and ranking member for both the House and Senate, announced they had a deal on what we call the top line number for the Omnibus Appropriations bill. That's how much would be spent on the defense side and the non-defense side, so that all the subcommittees could then write their bills that would then get folded up into an Omnibus Appropriations bill. Of course, when they announced this agreement, they didn't also announce the number that they had actually agreed to. I think they did that in part to keep the sniping from both the progressive side and the conservative sides to a minimum, so that they weren't trying to tank the bill before it's even written. But we are hearing some contours or aspects of this bill are starting to emerge. starting with, we were told directly from the House, a member in the House leadership, that the House plans to vote on this bill next week on Tuesday, ahead of the Democratic Issue Summit that they're having in Philadelphia, starting on March the 9th, running through March 11th. So that was a pretty firm commitment we had for a House vote on Tuesday, with the Senate vote to follow after that. We were also told that they've reached an agreement on what we used to call the so-called earmarks. Now they're called congressionally directed spending. And the good news is, if your project was in either a House or Senate bill, it will be in the Omnibus Appropriations Act. Now, we've not seen text of that bill yet, so we don't want to celebrate too much about the Santa Clara projects that were in play in those two bills, but nevertheless, it's a very encouraging sign that hopefully those projects will come through the final process. We are also told that there's a possibility of some Medicare provisions making it into the bill. It is not likely that the bill will provide additional relief to the Medicare sequestration. You will recall that at the end of last year, Congress acted to delay the 4% sequestration cut stemming from the pay-as-you-go or pay-go statute, and provided additional 3 months of relief for the 2% sequestration cut from the Budget Control Act, and then lowered that cut from the Budget Control Act to 1% for the next 3 months this year. So it'd go back to the 2% starting July 1st. But it is possible to see an extension of the waivers for telehealth that were permitted under the public health emergency that we've been operating under since 2020. And on that front, we're expecting HHS to extend the public health emergency once again when it comes up in April, taking that out till July at least. It may be the last extension, because I think from a political perspective, I think the president and the Democrats in Congress don't want to be under a public health emergency as we head to the polls for the November elections. But as part of that, as I mentioned, the telehealth authorities that were permitted under these the public health emergency, it's likely that the omnibus will extend those waivers for a period of time. We're told that the Congressional Budget Office has assumed that the public health emergency will remain in effect until the end of the year. So Congress can extend those waivers until the end of the year without having to pay for them. And we're also told they may even take it out beyond the end of the year in terms of those telehealth waivers.
Mr. Mead, excuse the interruption. I try to let you run your course here, but I just want to make sure I understand when you say the end of the year, fiscal year, calendar year.
I'm sorry, calendar year.
Thank you very much. Go right ahead. I apologize.
No, I should have been more precise. There's also some talk of possibly some tax provisions making into the omnibus bill. There's an effort by many, bipartisan effort, to extend the research and development tax credit. Chairman Neal had a retirement package to offer incentives to small businesses to offer retirement benefits. And there was also some talk of maybe even including some of the international tax provisions from the Build Back Better bill in this omnibus. But from every indication, those tax provisions probably are not going to be included in this omnibus appropriations bill. They'll have to probably find another home to move forward. Finally, the president is requesting some additional funding. And to your point, Supervisor Lee, about the situation in Ukraine, the president's going to ask for some funding, both for some additional military assistance and for humanitarian assistance. The monies, we are told, are going to be split between the two. And it's possible that, well, they may act upon that request ahead of the omnibus appropriations and try to pass that supplemental funding for Ukraine even this week. But if it doesn't happen, it's most likely going to be made into the omnibus appropriations. The Department of Health and Human Services also requested an additional $30 billion in supplemental funding to address the COVID, and we are hearing that money is not likely to get into the bill because there's many or most Republicans don't want to spend any more money on COVID because there are amounts that have been appropriated, not yet spent. So their point is you should go and reprogram those monies not yet spent and put them into the needs that HHS has identified as part of their supplemental funding request. So we think that that supplemental funding request for COVID is probably not going to move as part of this omnibus package. It will probably move on its own, and we expect the House can pass that HHS COVID supplemental bill. The Senate may be a steeper climb to get 10 Republicans to come on board with it. It's possible it can get through, but just it's going to be a little bit more challenging to face. With that, let me pause for any questions you have on the appropriations bill before we turn to my colleague Aaron for a report on the endemic.
Thank you. Let me ask Supervisor Lee if he has comments or questions. Then I do want to pull in Mr. Pike from Congressman Khanna's office, just in case he's got a little insight as well here. So first to you, Supervisor Lee.
Not at this moment. Thank you.
And Mr. Pike, anything you can share that helps shed a little more light on this?
Yeah, well, first I want to say thanks to Mr. Meek, because I was getting a little bit of information beyond what I had. I'm looking at the calendar. March 11 is actually a week from this coming Monday. So that's what we're looking at. The word I had from my legislative director this morning is that they were, cautiously optimistic about getting the omnibus bill passed next week. Again, as Mr. Mead mentioned, the CPF, the community project funding, formerly known as earmarks, are in it. And of course, that reflects on the API community health project that we're wanting to get funded for the county as soon as possible. The one note that I do want to add is, not only is it just a matter of, well, hey, let's get this done, but if it is kicked down the road a bit more with another continuing resolution, then you're actually risking the 2022 community project funding program. Because what we're talking about right now is the submissions we took last year, the things that got into the House bill at the end of last year and moving forward. And so if we get kind of, too backed up, that might impact the 2022. So that provides just all the more impetus to get this done, get the 2021 CPF funding out there, and then hopefully get our 2022 proposals going. I'm told we want to start getting proposals before June. We don't have a lot of details yet about upcoming, but I think county and everybody else should kind of have it on their radar that we're looking at some point before June, getting submissions for the current year's proposals. So that's the additional information I have.
Thank you. All right. Mr. Mead, I'll turn it back to you. And if you want to turn it next over to a colleague, that's fine too.
Great. I'm going to turn to Aaron to give you a report on the transition from pandemic to endemic.
Good morning. Thank you, Mr. Mead. Good morning, Supervisor Smitty and Supervisor Lee. Thank you for having me. My portion of today's update from the Prime Policy Group focuses on federal government, the federal government efforts and strategies surrounding the shift from pandemic to endemic, which was touched on by the President last night in the State of the Union. So scientists will tell you an endemic infection is one in which overall rates are static, not rising, not falling. More precisely, it means that the proportion of people who can get sick balances out the basic reproduction number of the virus, the number of individuals that, or the number of individuals that an infected individual would infect, assuming a population in which everyone could get sick. As you're aware, the CDC last week announced it's relaxing its mask guidance for communities where hospitals aren't under high strain. Under the new guidance, nearly 70% of the US population lives in an area considered to be low or medium risk. Residents there are advised they can go indoors without masks. However, the CDC recommends continued mask use in communities where serious cases of COVID-19 are straining the health system. And I'll now try to explain the strategy behind the switch. The move to ease up on masking reflects current conditions at this phase of the pandemic. Specifically, Omicron's high infectivity rate coupled with vaccination and past infection will result in some type of immunity to the virus becoming common, which is, or the some type of immunity becoming common, which is leading us from the pandemic state of emergency to what will likely be a coexistence with COVID-19 or more of an endemic state. This rising immunity to COVID-19, in which over 200 million people have received a primary vaccine series and nearly 100 million have been boosted and millions more have had the prior disease, along with more tools to protect ourselves, like availability of high quality masking, broader access to testing, and the availability of new prescription pills, have put us in a very different place than we were 2 years ago. So with that widespread population immunity, the overall risk of severe disease is now generally lower. But as the virus still continues to circulate in our communities, this is where they are now shifting the focus of metrics beyond just cases in the community and test positivity toward now directing efforts toward protecting people at high risk for severe illness and preventing COVID-19 from overwhelming our hospitals and healthcare systems. The new metrics, this new updated metrics framework helps to determine whether the level of COVID-19 and severe disease are low, medium, or high in a specific community, as I noted earlier. And as I said, they also include strong predictors of the potential for strain on the healthcare system. A community's specific COVID level is determined by a formula, a combination of 3 pieces of information, which will determine if the level is low, medium, or high. Those are new hospitalizations for COVID-19, current hospital beds occupied by COVID-19 patients or hospital capacity, and new COVID-19 cases. The CDC has announced it will release updated county by county risk levels based on those metrics weekly on its website. I'll now give just a quick brief description of each level. And I should also note that regardless of level, the CDC continues to recommend, at the very basic level, that people stay up to date on vaccines and get tested if they're sick. So starting with the low level, if a community is determined to be at a low level, that means there is a limited impact on the healthcare system and low amounts of severe disease in the community. So the basic instruction to them is to stay up to date on vaccines and get tested if they're sick. At the medium level, which is where I believe the county of Santa Clara is at the moment, more people are experiencing severe disease in the community, and they're seeing more impact on the healthcare system. And the recommendation at this level is that people who are at high risk, such as someone who is immunocompromised, should talk to their healthcare provider about taking additional precautions and may choose to wear a mask. As communities enter into the higher level, there's obviously a high amount of people experiencing severe disease and high potential for healthcare system strains. At the high level, the CDC recommends that everyone wear a mask indoors, in public, including in schools. In addition, while tracking this data, communities can use these metrics along with their own local metrics, such as wastewater surveillance, just as an example, to update and further inform their local policies and ensure the equity and prevention efforts. These categories will help individuals assess what impacts COVID is having on their community, so they can decide if they need to take their extra precautions based on their own personal health status and risk. So just by way of the new updated CDC guidance for masking, which has been a huge part of our lives for the past few years, if you're in an area with high COVID community level and are ages 2 or older, you need to wear a mask indoors in public. If you are sick and need to be around others, or are caring for someone who has COVID-19, you need to wear a mask. And if you're at increased risk for severe illness or live with or spend time with someone at high risk, you should speak to your healthcare provider about wearing a mask at medium community levels. All of these factors that I've described really stem from the fact that we have more and more vaccinated and boosted people and more immunity in the population from prior infection. More widespread immunity should balance these new infections and the severe disease and hospitalizations. So the main metric that will lead us to endemic is tracking how much severe disease is happening and how many hospitalizations. Many of the recent infections from Omicron did not result in severe disease. It did not result in increased hospital capacity. And so that was the context in which they made the pivot to the new framework and guidance. And so that's all I have on that piece for today, but I'm happy to answer any questions if I'm able.
Thank you very much. Questions, Supervisor Lee?
Yeah, thank you. So looks like at this point, we are basically pronouncing that this endemic is happening and that we are very likely to be able to measure the type of restriction based on the lower case rate. So everything is basically still very much fluid, right? We're still adjusting based on the case rates. If the case rate pop back up, new variant comes back, we could probably go back to masking and all the other stuff as well. But in the meantime, looks like we have a pretty decent trend. Am I correct?
That is correct.
Okay, thank you.
That said, Ms. Dorton and others at Prime, I was focusing for a moment, as you may have noted earlier, on the indication that the emergency status was anticipated to run through the remainder of this calendar year, as we clarified. What are the implications of that status and it being maintained over the course of the coming year? I see, I think Ms. Powell's popped up and Mr. Mead's lit up again, and so so what should we make of the fact that that status could be with us for a while?
I'm happy to have one of my colleagues jump in. Go ahead.
I was just about to say that under the public health emergency, a number of waivers have been given, particularly in the healthcare space, in terms of, as I mentioned, telehealth is one big area. Also, there's a waiver of a requirement to enter into a skilled nursing facility. They've eased up on hospitals' ability to move patients from the hospital to the skilled nursing facility. There probably are some areas I'm not that familiar with under OSHA and other public safety requirements. And I don't know if Aquila is familiar with those or not, but like I said, there's a lot more flexibility under the Medicare program given to providers with this public health emergency.
Yeah, I was going to also add that with the public health emergency, children on Medicaid cannot get disenrolled from the program. So when the public health emergency ends, there is a strong likelihood that millions of children will lose their coverage, because when they passed the COVID relief package back in March of 2020, there was a provision in there to give the states matching Medicaid funds. I believe it was 6.2%. That will end at the conclusion of the public health emergency.
And to that point, Aquila, it's a good catch on your part. The number of those who would lose their coverage nationwide is 15 million. So it's a pretty significant number.
And that 15 million who might lose their coverage would no longer be eligible because they would have aged out or have economic reasons why they are no longer eligible. What's the basis for them losing their coverage at that point?
I think it's a little bit of both. Essentially, the states are going to have to conduct eligibility reviews to determine what their enrollment is going to be.
Okay, thank you. Given our state's size and then our county's size within our state, if you do a little math, even at the local level, the net impact on a county our size of that 15 million could be significant. So we'll just ask our staff to be mindful of that. And if we could ask Prime to perhaps keep us abreast of any developments in that area, as well as ask Mr. Margolin, who we're going to hear from in a couple of minutes, to do the same. Thank you for that. Let me check with Mr. Lee, Supervisor Lee. Anything else on this item, which is our report from the folks at Prime on behalf of the County Executive's Office regarding these federal executive and legislative actions?
Nope, we're good. Thank you.
Okay. Anything else from Prime? I
don't think so at this time.
Thank you. And then let me turn to Ms. Christian, who's our air traffic controller, as I call her, and say, anything else on this item, Ms. Christian?
No, thank you very much, Chairperson Smitty.
All right, then without objection and hearing none, we will deem the report received. And that takes us to item number 8. Forgive me, I forgot to check with the clerk to reassure myself. No one teed up to speak on item number 7, going to the clerk.
That is correct.
Then we will go to item number 8. And I believe we're going to hear from Mr. Margolin on various matters relating to federal health policy and budget landscape.
Yes, good morning. Let me start by making a comment about the public health emergency, sort of following up on what Prime Policy just said. This is a matter of concern. There's federal money that will stop flowing in terms of an enhanced FMAP to California. And there are these redeterminations of Medicaid eligibility that could, as Prime indicated, jeopardize coverage for large numbers of Californians. This is an issue that the state of California needs to be prepared for. And as of right now, at least, the legislature and the governor have not really been paying a lot of attention to this. They've been operating on the assumption that the emergency is going to continue for a period of time. There is a commitment by the administration to provide a minimum 60 days notice to the states before they end the public health emergency. And as Mr. Mead indicated, it's likely to continue on for several more months. But it is something that we all need to track and follow, Prime Policy, our group, and the county itself, because there's money at stake, funding at stake for healthcare services, but more importantly, there's the coverage issue for all the people who've been able to stay on their health insurance without having to go through this redetermination process. So we are going to be tracking that. In terms of federal healthcare policy, I want to really focus on the State of the Union address last night and what we thought would be an important milestone in the president's effort to move a health agenda. Initially, after Build Back Better died in December, Senator Manchin stopped that bill moving forward. There was a period of time, didn't last that long, but there was a period of time when Democrats thought that maybe the president's State of the Union would be a new deadline for reestablishing a smaller or creating a smaller Build Back Better package with some of these healthcare provisions that are important to the system being repackaged and moved forward. It soon became apparent that Senator Manchin wasn't going to negotiate in the short term and that a package couldn't be enacted by March 1. Then the focus shifted to, well, perhaps the president, by the time of the State of the Union, would indicate in some fashion what his priorities would be in a smaller Build Back Better package and what elements of the healthcare agenda would be moved forward. All of this is being done in the context of this reconciliation mechanism, 51 votes still being available. It's hard to believe, as we've discussed in the past, that the Democratic majority will let that reconciliation authority expire without moving at least some portion of the Build Back Better agenda forward. It seems very unlikely that it will expire, not impossible, but unlikely. So last night, we thought the president would highlight what his priorities would be. And while he did talk about many aspects of the Build Back Better agenda and the healthcare agenda, and I'll talk about them in a moment, there wasn't really a prioritization in his speech last night. Some issues were talked about more than others, and that's kind of an implicit prioritization, but he didn't say, as some thought he might, I really need this provision or that provision to pass, and this is my reduced package, and it must get done and on my desk within the next month. Now, what did he highlight? He did highlight prescription drug pricing reform. He talked about the $35 a month cap on insulin, on the cost of insulin, and he had that seventh grader up in the gallery that he introduced and showcased. That's an important priority. He made a reference to Medicare having the authority to directly negotiate drug pricing. So again, he lifted that issue up. He also talked briefly about an issue that I do think will be in any package that's put forward, and that is the Affordable Care Act premium subsidies that were part of the American Rescue Plan. They were passed, new subsidies to make the cost of coverage under the ACA much less. They were passed for only 2 years. They expire, these enhanced subsidies, at the end of 2022. Build Back Better was going to extend them for 3 additional years. Again, given the fact that especially if one or both houses of the Congress changes hands next year, any effort to strengthen the ACA is all but dead. It seems very likely that the Democrats will want to use their reconciliation authority to, at a minimum, get this ACA provision extended for 3 additional years. The president referred to it last night when he talked about the savings in ACA premiums. He mentioned $2,400 per individual as an example. That was a reference to the American Rescue Plan provisions that we're now trying to see extended in some version of a scaled back, Build Back Better. So again, there wasn't a major, or there wasn't really an effort at prioritization. The president mentioned within Build Back Better, most of its component parts. We'll see what happens in the next several weeks, though, as the Democrats continue to negotiate. There was also a reference to a program called ARPA-H in the president's speech last night, the Advanced Research Projects Agenda for Health. It's a proposal that the Biden administration first put forward last year, designed to fast-track biomedical research to fight diseases such as cancer and diabetes and others. It may sound like it replicates what the NIH currently does, but when you think about ARPA-H, the important thing to think about is that it's an effort to not just fast-track the research, but to change what research is done with an eye towards moving to market drugs and therapies that have the best chance of combating the most serious diseases facing the American public. So while NIH may focus on basic science, intriguing new treatments, and get the research going, they're not really geared up to look at taking these ideas all the way to market and making them available to the population. That's what ARPA-H would be focused on doing, from initial idea right to market and right to the individual consumer or patient. Last point I want to touch on involves something we talked about at the Health and Hospital Committee meeting, and that is there is one rare area of bipartisan agreement that's emerging in the Senate Health Committee. Senators Murray and Burr together have worked on developing something called the Prevent Pandemics Act. It's an effort to develop a strategy for anticipating the next pandemic and making sure that federal, state, and county governments are much better prepared to respond to the next pandemic. They have a sort of a draft proposal that's been circulating. They haven't acted formally on anything yet, but the anticipation is they will sometime this spring. Among the various provisions of the Prevent Pandemics Act are the creation of a task force to assess the U.S. response to COVID, kind of a look backwards for lessons learned. They also want to require the CDC to have a strategic plan, fully developed strategic plan in place to deal with future pandemics that would need to be revised every 4 years, so it's kept current. They want to improve access to public health data, make it more standardized. They want to expand efforts at genomic sequencing across the country. They want SAMHSA, the agency responsible for mental health and substance use disorder, to develop a plan to ensure access to these treatments during public health emergencies. They want more federal planning on how to deal with supply chain issues, a whole series of things designed to make sure we're better prepared for the next pandemic. Will this become law this year? Because Senator Burr is retiring, and he's working on this. He's a Republican, lead Republican, and he's working with Senator Murray on this bipartisan basis. There's a belief that this effort could, as a standalone bill, potentially make it through the process. And it's also possible that the ARPA-H proposal that we just talked about could be attached to it and be part of a larger package that does make it through the Congress this year. That completes my report. Happy to respond to questions.
Thank you. Let me pull Mr. Mead into the conversation as well, if I can ask him to pop back into his square. And thank you, Mr. Mead. And Mr. Margolin and Mr. Mead, let me start with Mr. Mead. Mr. Mead, I thought the number you tossed out in response to Ms. Powell's reference to Medicaid, kids on Medicaid being no longer eligible, losing their eligibility, excuse me, was 15 million. Did I hear that right?
That's the number I use, yes.
Yeah, and I guess I would ask either or both of you, You know, I did that quick math here on the calculator function on my smartphone, and you know that if I did my math right, that could be as many as 90,000 kids here in Santa Clara County. I think I did the math right. I mean, 15 million is a big number, even in a country this size. What kind of concern should we have about that potential, and what might the county do to prepare for and respond to such a thing, and or advocate at the state level for, you know, in the context of all that? Before I go to you, I'm going to go to Dr. Smith, who raised his hand. And so let me say, Dr. Smith, did you want to get a word in here before I turn to these gentlemen?
Well, I just thought give you a perspective from the local county structure. That is a huge number actually for us, and it will require additional eligibility staff and processes, and this happens at the same time that the state is implementing CalAIM, which will change around delivery systems and some eligibility, as well as covered California. So we're going to be suggesting to the board during the recommended budget, adding a number of staff in order to try to deal with these risks. It's clear that there are going to be changes of some sort. It's not necessarily clear exactly what the changes will be. So we're prepping for any eventuality. So I just wanted to let you know that.
Thank you. I may ask that we take up that item specifically at our Health and Hospital Committee at some point. So I'll ask my own office to put that on a list of things we should keep track of and make sure we're on top of. Back to you, Mr. Mead and Mr. Margolin. Any other thoughts or comments?
The first comment I'll make is that this is a real and significant issue. Then I think it's smart for you, the county, to prepare for it, because, you know, whether this comes, you know, this summer or at the end of the year, it's coming at some point in time, because this the public health emergency will expire at some point in time. I mean, it's not going to go on forever. So this unfortunate situation with the loss of coverage is going to be coming. In terms of, you know, you talked about some things you can maybe do at the county level to mitigate that. And I'm not sure, maybe Mr. Margolin has some better insights about what the state may be able to do at the state level to try and mitigate the loss of coverage.
Well, thank you, Mr. Mead. Well, the state definitely has a role to play. And one of the things that's worth noting here is that in the governor's budget and in the initial discussions in Sacramento, this hasn't really been on the agenda. So one of our challenges will be, in addition to what Dr. Smith does with the board in terms of making sure you have capacity at the county level, is we have a need to elevate this issue at the state level. This is a year in which the state has a budget surplus. We have this issue down the pike coming at us, and we need to enlist state assistance, state resources as well.
Thank you very much. Let me turn to Supervisor Lee, see if he's got comments or questions for Mr. Margolin or the Prime team.
Thank you, Ms. Margolin, as always, on your very insightful review here. Just going back to the whole idea of the provisions of Build Back Better, there really hasn't been a whole lot of change since last. I mean, the speech yesterday was very good. They talk a lot about potentially moving mental health being a very big issue, and also investing on children's mental health as well. Do you see that this will potentially end up with some additional funding that will come out in our way?
It's a potential. Again, there's just a lack of clarity about how this is being negotiated and what will actually be produced, but there's definitely a potential, and the president did touch on a number of these issues yesterday.
Now, if these issues are not yet on the Build Back Better bill, that would become a separate bill then that they would have to pass?
Well, Build Back Better again, no one's using that term anymore. You may have
Okay.
noticed the president didn't. We're using that term, and I know what you mean when you say it. The president, I thought maybe would give us a new term last night. He chose not to do that. Obviously, Ukraine and other issues were much more dominant. But whatever this new package is, it could be part of reconciliation. If it doesn't lend itself to bipartisan support, it really comes down to, is it an issue that you can get bipartisan support for? There are very few these days where that applies. And if you can't get those 10 Republican senators to join you, then you have to do it through reconciliation.
Right.
And-
Okay.
And Supervisor Lee, I'll just add that while there's that one track with the reconciliation vehicle, the Senate Finance Committee is also simultaneously trying to find a bipartisan consensus on a mental health standalone bill. And they've established a number of work groups on the committee to look at aspects of mental health care. And where this goes, we don't fully know. The chairman of the committee, Senator Wyden, has told his staff he wants a bill to be ready before the August recess. So I don't know whether they can do it or not, but they're certainly trying.
I see. So, for example, when you mentioned the Prevent Pandemic Act, that would be one of those as well. So it's not going to go through reconciliation, correct?
Yeah, that bill, because of the Burr-Murray coalition and
Right.
alliance, they're trying to make that a standalone bill. And,
Ah.
and there's a good chance it'll happen. No guarantees, but it could happen.
Sure. Well, it's hopeful. Yeah, so that's good news. Thank you. That's all I have.
Thank you.
All right, thank you both. And let me just check with the clerk to see if we have any one queued up to speak on item number 8.
There are no public comments at this time.
All right, then I will say thank you, Mr. Margolin. Thanks again to the team from Prime. Thank you, Ms. Christian, for pulling these folks together. And thank you to Mr. Pike from Congressman Khanna's office. The one last thing I will say is, well, I should just note for the record, we have received the report without objection, and hearing none, we will deem it received. I should just ask Dr. Smith, when he comes to our board with his report of the county executive on Tuesday next, and we are talking about these financial issues vis-a-vis the Russia and Ukraine, if we could also make sure that that conversation includes some consideration of the county's role in CalPERS, which of course is hundreds and hundreds and hundreds of billions. And I have to believe that we're part of that effort, of course, or operation. And they, of course, must be heavily invested in a wide range of things that do pull the Russia into the calculation. So if we can just be sure to make sure that's part of the consideration. Ms. Christian, I see you leaning in before we go.
Thank you, Chairperson Smitty. And I was actually going to share that Esther Diekman, who is the new district director for Representative Lofgren, joined the meeting after it started. But it looks as if she logged out right before I had a chance to say that.
All right. Well, we welcome her. Glad she is taking part. We have appreciated Mr. Pike's ability to sit in, both because it gives us a chance to share information with the congressman's office, so that Congressman Khanna is up to the minute on what we're interested in, but also because he can then offer insight as well. So with that, I think we will say thank you once again. And unless there's anything else from the clerk, without objection, we are adjourned. Thank you all very much.
Thank you.
Thank you.
Thank you.